but the results of this last month have been historic. As the president said, in the last month, think about this, 3,200, more than 3,200 violent gangs and drug dealers have been taken off the streets. Off the streets. Now, Director Patel and all of these agencies have also been working so hard on getting the leadership. But we are getting all the gang members off the streets and the drug dealers, Sinaloa, CJNG, MS-13, and more, TDA. 91 tons of drugs have been seized as a result of this task force.
The FBI just raided Biosafe Solutions, a medical waste disposal company operating in 14 states. What they found wasn't just contaminated needles and surgical waste. It was 4 tons of fentanyl, methamphetamine, and cocaine hidden inside biohazard containers. For 3 years, the Sinaloa cartel used ambulances, medical waste trucks, and hospital credentials to move narcotics across America completely undetected. Law enforcement never stopped vehicles marked with biohazard warnings and medical emergency plates. The cartel turned America's healthcare system into their personal drug highway. 47 people are now in federal custody. This is how they pulled it off. The raid began at 5:32 a.m. on a Tuesday morning in October. FBI tactical teams wearing full hazmat suits and accompanied by CDC officials stormed the headquarters of Biosafe Solutions in Newark, New Jersey. The company's logo, a red biohazard symbol enclosed in a protective shield, was displayed prominently on the building's facade. To neighbors and local businesses, Biosafe was a legitimate operation that safely disposed of medical waste from hospitals, clinics, and nursing homes across the northeastern United States. But federal agents knew differently, and what they discovered inside would expose one of the most ingenious drug smuggling operations in American law enforcement history. Attorney General Merrick Garland announced the results of the 18-month investigation, codenamed Operation Hazmat, at a press conference in Washington. The Sinaloa cartel infiltrated America's medical waste disposal system and used it to transport 4 tons of narcotics across state lines, Garland stated. They exploited the fact that law enforcement officers are trained to avoid contact with biohazard materials. They weaponized our caution, our health and safety protocols, and turned them into a smuggling network that operated in plain sight. The investigation revealed a scheme so audacious that even seasoned DEA agents were stunned by its sophistication. 47 individuals were arrested across 14 states. The charges included conspiracy to distribute controlled substances, money laundering, operating an illegal enterprise, and, uniquely, unlawful disposal of hazardous materials. The cartel hadn't just smuggled drugs, they'd contaminated America's medical waste stream with narcotics, creating a genuine public health hazard. In 2021, the Sinaloa cartel identified a vulnerability in America's regulatory framework. Medical waste disposal is a highly regulated industry governed by federal, state, and local laws. Companies that transport biohazard materials must be licensed, their vehicles must be specially marked, and their drivers must be trained in hazmat protocols. But there's a critical loophole. Law enforcement officers rarely, if ever, stop medical waste trucks for inspection. The reason is simple: safety. Medical waste contains infectious materials, used needles contaminated with blood-borne pathogens, surgical specimens, and potentially disease-carrying biological matter. Police officers conducting traffic stops are not equipped with proper protective gear to inspect these materials. Department policies across the country explicitly discourage officers from opening medical waste containers without CDC-trained personnel present. The cartel realized that a truck marked with biohazard warnings was essentially invisible to law enforcement. The Sinaloa cartel operatives established Biosafe Solutions as a legitimate business in 2021. They filed proper incorporation documents in Delaware, obtained medical waste disposal licenses in 14 states, and leased a warehouse facility in Newark. They purchased 10 refrigerated trucks and had them outfitted with the required biohazard markings, hazmat placards, and medical emergency vehicle designations. They hired real employees, drivers, logistics coordinators, administrative staff, most of whom had no idea they were working for a criminal enterprise. Biosafe then did something brilliant. They actually provided legitimate medical waste disposal services. They contracted with small hospitals, urgent care clinics, dental offices, and nursing homes to pick up and dispose of their biohazard waste. They charged competitive rates, provided professional service, and built a reputation as a reliable company. Inspectors from state health departments visited their facilities and found everything in compliance. Biosafe appeared by every measure to be exactly what it claimed to be. But running parallel to the legitimate operation was a criminal network. The cartel recruited 23 drivers who were in on the scheme. These drivers had clean backgrounds, valid commercial driver's licenses, and hazmat certifications. Several were former emergency medical technicians or paramedics who understood medical protocols and could speak convincingly about biohazard procedures if questioned. The smuggling mechanism was elegantly simple. Drugs would arrive at the Newark warehouse from Mexico through traditional trafficking routes, hidden in commercial shipments, smuggled across the border in vehicles, or brought in through cartel-controlled points of entry. Once at the warehouse, cartel operatives would package the narcotics in specially designed biohazard containers. These containers were genuine medical waste receptacles, the same red plastic sharps containers and yellow biohazard bags used by hospitals nationwide. But the cartel had them custom manufactured in China with hidden compartments. The exterior was authentic, complete with biohazard symbols, disposal instructions, and warning labels. But inside, beneath a layer of actual medical waste purchased from corrupt hospital employees, were kilograms of fentanyl, methamphetamine, and cocaine, vacuum-sealed and protected from contamination. The trucks would leave Newark on scheduled routes, ostensibly to pick up medical waste from client facilities. They'd make legitimate stops at hospitals and clinics, collecting real biohazard materials and loading them into the trucks alongside the drug-filled containers. Then they'd drive to distribution points in major cities: Philadelphia, Baltimore, Charlotte, Atlanta, Miami, Chicago, Detroit, and Cleveland. At each distribution point, cartel associates would meet the trucks at what appeared to be medical waste processing facilities. These were actually cartel warehouses disguised as legitimate disposal sites. The drug-filled containers would be offloaded, the narcotics extracted, and new containers filled with drugs for the return trip north would be loaded. The trucks would then complete their routes, deliver the legitimate medical waste to actual disposal facilities, and return to Newark. The cycle would repeat 3 to 4 times per week. The genius of the operation was its built-in protection. Medical waste trucks are exempt from many DOT waste station requirements. They travel in HOV lanes during rush hour in some states because they're classified as emergency medical vehicles. Police officers who pulled them over for traffic violations, which happened occasionally, would see the hazmat placards and biohazard warnings and conduct only cursory inspections, never asking to see inside the cargo area. On one occasion, documented in the FBI's investigation, a Maryland state trooper pulled over a BioSafe truck for speeding on I-95. The driver was polite, produced all required documentation, and explained he was transporting time-sensitive medical waste that needed to reach an incinerator facility before the end of the business day. The trooper could see biohazard containers visible through the truck's windows. He issued a warning and let the driver go. Inside those containers were 120 kilograms of fentanyl worth approximately $3.4 million on the street. The FBI's breakthrough in the case came from an unlikely source: a hospital infection control nurse in Philadelphia. She noticed something unusual in late 2023. Her hospital had been using BioSafe solutions for about 18 months, and the service had been excellent. But she observed that BioSafe trucks were visiting the hospital more frequently than the volume of medical waste generated would require. Her hospital produced approximately 400 pounds of regulated medical waste per week. BioSafe was picking up twice weekly, which was appropriate. But she noticed that the same BioSafe truck that picked up from her hospital would return 2 or 3 hours later and park in the hospital's loading dock area for 15 to 20 minutes, but wouldn't enter the facility or collect any waste. The driver would sit in the truck, then drive away. Curious and trained to notice biosecurity irregularities, she began documenting these visits. Over a 6-week period, she recorded 11 instances of a BioSafe truck arriving, parking, and leaving without conducting any business. She reported her observations to hospital security, who reviewed loading dock surveillance footage. The footage showed that during these visits, individuals in civilian clothing would approach the truck, the driver would hand them small packages, and they would leave. Hospital security contacted the FBI. Special agents began surveillance on BioSafe trucks in Philadelphia and quickly identified the pattern. The trucks were making drug deliveries during their scheduled medical waste routes. Agents obtained warrants for GPS tracking devices and discovered that BioSafe trucks were making stops at locations that had no medical facilities: warehouses, private residences, storage units, and commercial buildings in high drug trafficking areas. The investigation expanded rapidly. The FBI worked with the DEA, CDC, and state health departments to map the entire BioSafe operation. They identified the 14 states where BioSafe held licenses. They subpoenaed financial records and discovered that BioSafe was generating revenue far exceeding what their legitimate medical waste contracts would produce. Forensic accountants found $340 million in unexplained deposits over a 30-month period. Working with Mexican authorities, the DEA traced Biosafe's ownership through shell companies to a Sinaloa cartel lieutenant operating out of Culiacan. Phone intercepts revealed conversations in code discussing container shipments and clinic schedules, cartel slang for drug loads and delivery times. The FBI planned the takedown meticulously. On the morning of the raid, they hit 23 locations simultaneously: the Newark headquarters, 10 regional warehouses, 9 residential properties, and 3 storage facilities. Agents seized the 10 Biosafe trucks, finding drugs in 7 of them at the moment of the raid. Inside the Newark warehouse, they discovered a packaging operation where cartel workers were loading fentanyl into biohazard containers surrounded by actual medical waste. The seized drugs totaled 4 tons, 2,800 kilograms of fentanyl, 900 kilograms of methamphetamine, and 300 kilograms of cocaine. The DEA estimated the street value at $1.2 billion. To put the fentanyl quantity in perspective, the CDC estimates that 2 milligrams of fentanyl can be a lethal dose. The amount seized could have produced approximately 1.4 billion potentially fatal doses. But the operation created another crisis, a public health emergency. The cartel had been mixing drugs with actual medical waste, which meant potentially contaminated biohazard materials had been processed through legitimate disposal facilities. The CDC launched an emergency investigation to trace every container Biosafe had handled over 3 years. They worked with incinerator facilities, autoclaving centers, and landfills where medical waste had been sent to ensure that none of the narcotics had contaminated workers or entered the environment. The investigation revealed that several hospital employees had been complicit. The cartel paid them between $5,000 and $15,000 per month to provide medical waste that could be mixed with drugs in the containers. These employees, orderlies, janitorial staff, and low-level administrators would save sharps containers, used surgical materials, and other biohazard waste and sell it to Biosafe. This gave the cartel authentic medical waste to use as camouflage. 12 hospital workers across 6 states were arrested and charged with conspiracy and illegal disposal of medical waste. Several hospitals faced potential penalties from state health departments for failures in their waste management oversight. The 47 arrested individuals included the 3 cartel operatives who ran Biosafe, 23 drivers who knowingly transported drugs, 9 warehouse workers who packaged the narcotics, and 12 hospital employees who provided waste materials. All face federal charges carrying sentences ranging from 15 years to life in prison. Federal prosecutors are seeking forfeiture of all Biosafe assets, including the trucks, warehouses, and $127 million in seized bank accounts. The company's legitimate clients, the hospitals and clinics that used their services, were not implicated in any wrongdoing. They've been forced to find new medical waste disposal vendors, creating logistical challenges for healthcare facilities that rely on daily biohazard removal. The case has prompted urgent calls for reform in medical waste oversight. Currently, the EPA regulates medical waste disposal, but there's no federal database tracking waste shipments in real time. Trucks can cross state lines with biohazard materials with minimal oversight. The Medical Waste Tracking Act of 1988 expired in 1991 and was never renewed, leaving a patchwork of state regulations with significant gaps. Senator Amy Klobuchar has introduced the Biohazard Transportation Security Act, which would require GPS tracking on all medical waste vehicles, create a federal registry of licensed haulers, and mandate random inspections of biohazard shipments by trained CDC personnel. The medical waste industry opposes parts of the legislation, arguing it would create excessive costs and administrative burdens. But law enforcement officials insist the threat is real. The Sinaloa cartel identified a blind spot in our security infrastructure, said FBI Director Christopher Wray. They found a category of vehicles that police don't stop, a type of cargo that officers won't inspect, and they exploited it ruthlessly. This won't be the last time cartels try something like this unless we close these regulatory gaps. The most disturbing aspect of Operation Hazmat is how long it took to detect. Biosafe operated for 3 years, making an estimated 2,400 drug deliveries, transporting 4 tons of narcotics, and generating hundreds of millions of dollars for the Sinaloa cartel. They did it using trucks marked with medical symbols, driving on American highways in broad daylight, protected by the very safety regulations designed to protect public health. One DEA agent involved in the investigation put it bluntly, "They turned ambulances into drug mules. They turned hospitals into unwitting accomplices. They proved that the more legitimate something looks, the more invisible it becomes." That's the future of drug trafficking, not tunnels and submarines, but exploiting the systems we trust most. As the prosecutions move forward and the regulatory debates continue, one question haunts everyone involved in the investigation. If the cartel could do this with medical waste trucks, what other trusted systems have they already infiltrated? What other vehicles marked with official symbols are moving drugs across America right now, hiding in plain sight behind warnings that keep law enforcement at a safe distance? The answer, federal agents fear, is something they're only beginning to discover.